once again we are back on ttalk Boond Soch ki train of thoughts with a series of an episode with Dr. Viswanathan Iyer, who is a chief neurosurgeon and MD with Qualilife, basically into brain and spine, and also cycling mayor of Mumbai. I think we started with his journey as far as the education part which are concerned. Let's listen from him further insights. So can you please share with our target audience what your education journey like?
Yeah, so like we discussed last time, I think I did work very hard, and after my 12th I got admission into Grand Medical for my MBBS. I was in a cocoon, very protected environment till my 12th. Home food, just go to college, study, come back home. So I was not exposed to anything probably beyond that. So when I entered medical school, JJ is a huge campus, and there are students from all over India there. There are students from interior Maharashtra, from the north of India, and I was never exposed to all this. Right. So the first 3 months probably went in just orienting myself to how to eat in the canteen and how to talk to people who probably don't know Hindi and Marathi so well. So it was a very nice learning curve. And in those 3 months, I think I probably opened my wings to seeing the world in a more broader way. Because from my school days, I was always into just books and limited number of friends. And in JJ, we had a huge kind of an audience. I used to live in the hostel that time. So it had really opened my wings to a good
So you wondered about an hostel, normally we see a lot of movies and all, we see the ragging happening and all, and your first day being part of a medical profession, So any sorts of an experience in the span of 5 or 6 months where you felt why?
We were ragged for almost 3 months. And the ragging used to start from Sandhurst Road station. So when we used to get down at Sandhurst Road station to walk to JJ Hospital, the seniors used to be in the next compartment. So we were literally made to do all funny kind of activities in the train compartment itself. And on the platform and on the way to JJ Hospital. It was never beyond the line. I think it was just about allowing you to do certain things which make you come out of your shell. And you also learn to know the senior. And the same senior after 3-4 months will give you his books, his notes. So you develop contacts. So I don't think the ragging pushed me into a very negative psychology kind of way, because it used to be with good limits. And even in the hostel, we used to have those singing, dancing performances and all that. But I don't think they ever, crossed the boundaries of decency.
So Dr. Viswanathan Iyer, in as far as your hostel life which is concerned, so since you were more confined as far as the education part which was concerned more towards the books and all, so how you got a chance to open up while being part of a larger group and with various diversity as such?
I think one good advantage I had was a South Indian living in Mumbai. So I had a lot of language capacity. So I could speak Tamil, Malayalam, Hindi, Marathi. I lived in Malad that time, so I used to speak a smattering of Gujarati also. English definitely. So it was very easy for me to connect with all the different students from all over. So I think language is a very important gift, and probably living in another state from your mother state helps you, because in school itself you learn 2 extra languages.
Correct.
And at home you have a couple of more languages. So that was one good thing. And second was, I think in those times it was never about being very formal. You could just knock into any room, go to anybody, just talk. So the hostel life, I think the doors are never locked. You just go to anybody's room, and within few months we develop a lot of friendship with a lot of people.
How, in fact, more or less the library was your place where you used to be, or your excellent faculties you were having in your college?
We did have great faculty for the few subjects in MBBS colleges, but I think in MBBS, or rather I would feel any professional college, it's a lot about self-learning. So going to the library and sitting there throughout the night and reading is like a compulsory kind of thing. So we used to have one book, but there were always reference books, which you could not really afford to buy all the books. So the government library in JJ was very well equipped, and used to go on till probably 11-12 in the night. And even after that, the staff members were not there, but you could sit and read there till late night. So library is of course a very important part of life in medical school.
Was college totally towards the books, or you had friends and the circle and any way where you crossed certain limits and you felt defocused?
Yes, I think the first 3 months was in euphoria. I got medical school, now I am done. So first 3 months you are nowhere into studies, because you are still in that euphoria of achieving that medical school admission. But we used to have a lot of these tutorials, and every 2 weeks the exams and stuff like that. So the faculty made sure that we are never totally chill and relaxed. Okay. Friends, we used to do a lot of picnics, and every new movie we used to go for the first day release itself. We used to have trips to SL World and Gorai Beach, and so there were lots of good outings. But because of these repeated exams, you never totally lost focus.
So you're confined to, you're very focused in terms of what you need to do while you are here,
I don't think there was any option.
Okay.
Because from that background where okay, there is only one chance, I'm not going to pay your fees again. I think there's no leeway of, not studying and really losing track.
Correct.
You do enjoy yourself, of course, because that is a time of your early youth. So you can't miss out on enjoyment. And in medical school, the friends are really very strong, thick friendships. I'm in touch with many of them even now, very, very strong friendships. So we do have a time to enjoy, but ultimately everybody comes back to the library and we help each other study.
Okay, great. So that was a journey as far as the Grand Medical College which is concerned. So then you went as a Master of Surgery with Lokmanya Tilak Municipal Hospital.
Yeah.
So how was your experience out over there and getting into the Master of Surgery, and why surgery as such?
Okay, I think it was a logical kind of, if you do you do first standard and second standard and third standard. Similarly, to be a neurosurgeon, you have to do your MBBS. You have to do a master's in general surgery first, and then you join a rotation program for neurosurgery. So doing an MS after my MBBS was always a fixed path to my neurosurgery goal. So in MBBS also the same thing. In your final year of MBBS, you need to do very well in your surgery subject. And if you do very well in surgery subject, then you get surgery seat in one of the government colleges or municipal colleges in Bombay. And that time it was only JJ, Sion, KEM and Nair. So these were the few, 4 colleges. And the amount of surgery seats probably were just about 12 or 14 a year. So out of all the MBBS students who are interested in surgery, to be able to get those 1 in 12 seats was a stiff competition.
And one thing as a human being, when we talk in terms of brain, and that we talk in terms of neurosurgery as such, anything which was in your mind, like how you're going to touch human brain, and then maybe I think it's a great amount of risk also which is involved. So what was your first experience when you got into the understanding what brain surgery and operating on that?
Honestly, during MBBS and even during general surgery, we are just about briefly exposed to neurosurgery per se. Because neurosurgery is a very, very advanced kind of thing. So during MBBS, we have dissection in anatomy. So we do have to dissect the human brain, spinal cord. So you are exposed to all that anatomy very early in the first year itself. And during surgery, general surgery, it is more about chest and abdomen. Okay, brain is a different subject. So we don't really expose ourselves to neurosurgery in MS. So we may assist a neurosurgery senior to do his surgery. And because I was always keen to be a neurosurgeon, I used to go to the neurosurgery theatre even during my MS days. But the exposure was very limited till I actually joined neurosurgery.
Got into neurosurgery, yes. Okay. After your masters, you got into the Diplomat of a national board, So now talking in terms of hierarchy in neurosurgery as such. So can you talk in terms of brief about Diplomat of a national board? What the importance of that?
How it is, after MBBS you do MS. So in my Diplomat of National Board is like a super specialty degree course. So neurosurgery comes into super specialty, similar to cardiac surgery, plastic surgery, urology. So these are the multiple subjects. So after your MS, if you allow me to speak a little bit, MS is probably the time when actually a man of surgery is made.
Correct. Correct.
During MBBS, you always have teacher, protection, everything is there.
Correct.
When I joined MS in surgery in Sion Hospital, one of the heaviest municipal hospitals in terms of patient volumes in Bombay, I think it used to be like a mad kind of a job. The first 6 months to 1 year, literally we used to have break once in 36 hours. So it was a really tough time, and for the first time in my life, in the first 3 months, I did feel once and twice, why am I here and shall I just go home? But again, that focus helped me to come back. Surgery in Sion is like a mix of stab injuries, road accidents, train accidents, fighting, and occasionally bullet injuries from Maramari in Dharavi and Sion and many places. So we used to have a trauma ward where literally every day at least 15 patients of varied levels of trauma will come, accident cases.
Your first experience with looking at these certain maybe accident or so, and where you feel like, oh my God, what happened? Any kind of feeling that trauma as such?
I don't remember a negative kind of a feeling like that, because what happens is that the training program is made in such a way that your immediate senior always hand holds you.
Correct.
So if I'm in first year, the second year resident will be so-called my mentor. So he will literally handhold me throughout every learning stage in my career. So during my MS days, the first procedure you do, the first simplest of things you do, there's always a second year with you. So because of that, it's like an apprenticeship. So those 3 years, you have a huge faculty of immediate senior, then your lecturer, associate professor, professor. So at each level you are handheld and you are taught like a milestone, single by single. So you really don't feel suddenly that you are in awe and you don't know how to handle yourself. So science surgery was very, very well planned and amazing experience because of those hardships. I think 3 years of literally sleeping once in 2-3 days, working extremely hard. Sometimes we never used to go back to our rooms in 2 or 3 days time.
Oh, I see.
And those times the nurses used to bring food for us. So it's like a mix of bad and good.
Yeah. Now, in fact, then from there, you went to you did your international MSc, from Paris and France. How you got into that? Were you exposed to that environment, or it's through once you were part of a journey you got an exposure? Yeah.
So what happens is that after surgery, when I joined Bombay Hospital for neurosurgery, it was a totally different kind of environment. From a very heavy municipal college situation, I moved to Bombay Hospital, which is a mix of a private and charitable institution. So there I learned probably with my seniors the art of talking to families, talking to the patients, conducting myself. Because I think a very important part of being a doctor is not only your clinical and surgical skills, a communication skill becomes very important.
Correct.
Because the family comes to you with a lot of worries and you are supposed to talk to them and explain to them the problem, let them get faith on you. See, somebody is handing over their father or mother's brain on your operation table. So I think that conduct and that behavior and public speaking or other communication skills were really honed up of mine in Bombay Hospital. Nice. So I had the fortune of working with Dr. Bhagwati, who is one of the pioneer and very, very senior neurosurgeons of India, probably one of the first few neurosurgeons of the country. So being with him for 6 years, looking at him work so hard at that really good stage of his life and age also, made me feel that, okay, I am still very young. If he can work so hard, there's no way I can chicken out. After doing that 4 years in Bombay Hospital, I think after every neurosurgery career, you need to have a subspecialty.
Correct.
So many of us, general neurosurgery you do, so basically you're taught about everything for brain and spine. And then there are subspecialties like, okay, you focus yourself on spine surgery, or you focus yourself on pediatric neurosurgery, only children, or you do vascular, which is mainly diseases of the arteries and veins of the brain and spine. So I decided that I want to be sort of a specialist in that part of neurosurgery. And that is why I enrolled myself for the master's program in neurovascular diseases.
Good, great. I think it was a great insights to what we're getting from Dr. Viswanathan Iyer and many of the medical professionals who are listening to him about his education career and how he started and now how step by step he had progressed and gone to the next level. There's a lot to catch from his story. Do catch up with Dr. Viswanathan Iyer on ttalk Boond Soch for our next glimpses of his experience. Just go to www.ttalk.net, subscribe and like the channel as much as you can. So thanks a lot.
Thank you so much.
Again for being part of this show. Thank you very much. God bless you.